Hello there, and welcome to this discussion of our Healing Arts program. We are thrilled to bring you this community-based mental health project, which uses three elements: drama, meaning theater. We have performing artists, music in the form of instrumental and vocal artists, and dancing and poetry and writing. And we also have mental health professionals here to talk to us about how people who are experiencing mental health issues can use professionals for resources to help them address the issues. And we do mention about how, COVID has impacted so many lives, causing loss, which causes depression and anxiety, such as loss of finances, loss of job, loss of family, and other losses that we all experience to some extent or another. So today we welcome, he's kind of famous around Cleveland and halfway around the country, I guess, Dr. Charles Modlin of the Metro Health System, who has many, many years of mental health experience, as well as his major medical department, kidney. Are you still doing kidney work with Metro Health?
So yeah, Metro Health doesn't actually have a kidney transplant program, but I'm very much involved in terms of promotion of the importance of organ donation and transplantation. And I help Metro Health patients access opportunities to receive kidney transplantation,
As well as help people, especially Black males. And it does apply to all minority and non-minority men, because traditionally, tell us what challenges, and Judy's questions are coming up, what challenges men in general have with taking care of themselves mentally, physically, emotionally, and even spiritually for that matter.
Well, first of all, I'd like to thank you for inviting me to be part of this educational opportunity, community educational opportunity. It's a pleasure to be here. And, I appreciate you covering this topic. So African Americans, and in particular, African American males, men of color, do suffer disproportionately a higher incidence of chronic health conditions, a number of conditions, whether it's hypertension, high blood pressure, diabetes, heart disease, kidney disease, variety of types of cancers. Black men develop and die from prostate cancer twice as often as their white male counterparts. I mean, these are just some examples of health inequities, health disparities that are experienced and that burden, especially African American populations. To a certain extent, a lesser extent, Hispanic Latino counterparts experience a number of these health inequities. But these health inequities, by and large, including maternal and fetal mortality, higher rates. There are disparities in children also for a number of diseases: asthma, fatal drowning. That's a health disparity that we see 10 times greater incidence in our Black teenage kids. These health disparities collectively result in a shorter life expectancy that we as Black people have compared to our white counterparts, both female and male counterparts. So, why is this the case? I mean, so I'm a urologist. As you mentioned, I practiced kidney transplantation at Cleveland Clinic nearly for 30 years. There are physical manifestations of I mentioned these physical manifestations of these inequities, but there's also psychological, mental health, behavioral health, health disparities. And the reasoning is, and we've discovered that about 80% of the healthcare disparities that I mentioned are related to what we call the social determinants of health. Historically, previously, we thought that a lot of these disparities, the majority of these disparities were related to genetics, hereditary predisposition. And actually that hereditary predisposition to genetics, biologic factors do account, for a significant number of the healthcare disparities. But research has shown that social determinants of health, living impoverished, not having access to health care, health insurance, living in food deserts, being hungry, not having healthy, fresh fruits, vegetables, living in dangerous environments where you can't get out and take a walk around the block, living in toxic environments, polluted environments around factories, living in homes that have lead paint. All of these things are examples. Lack of education, lack of transportation, lack of jobs. I mean, these are what we call the social determinants of health. Since George Floyd, I think the nation has woken up a little bit more so than what it had with respect to recognizing that racism itself is a social determinant of health. Racism, because racism, and getting, I'm being a little bit long-winded to get your question, but racism contributes to chronic stress, chronic anxiety, and that leads to a milieu of biochemical hormonal changes within your body that releases cortisol, for example. That's the stress steroid. Epinephrine, norepinephrine, these are the fight or flight hormones, stress hormones that actually circulate in our bodies at higher levels and constrict our blood vessels, our arteries. Peripheral vascular causes peripheral vascular disease. We have small blood vessels and arteries in our brains, our carotid arteries in our hearts. This chronic stress leads to higher cortisol levels, which causes high blood pressure. Untreated hypertension, high blood pressure, we call it the silent killer. Heart attacks, strokes. I mean, we have 80% higher incidence of strokes, higher death rate from heart attacks. Stress can actually even potentiate the biologic manifestations of cancers, it's believed. So yeah, the state of affairs, living while Black in America, contributes to a higher anxiety, stress, depression levels, and it's a vicious cycle. It's hard to get out of that once you get into it.
Well, thank you so much for that excellent education, something that we all know intuitively, but you've really broken it out for us. So for your time with us today, we want to ask you that, given your experience with minority men's health, comment, if you would, on the occurrence and the sources of depression in men.
Yeah. Well, actually, and studies have shown, not just in men, but in women of color also have a 20% or even higher greater incidence of clinical depression, and that is something that is often underdiagnosed. And again, just whether it's overt racism, microaggressions that we experience, living while Black in America. And again, a lot of the social determinants of health, I mean, these are factors that predispose us to have, higher stress levels, anxiety levels, which, as I mentioned, lead to physical manifestations of disease. And we're seeing a higher incidence of stress, depression, anxiety in our adolescents. So much so that we're seeing escalating levels of suicide, not only suicide attempts, but actual suicides, even, and this shocked me, down to 5-year-olds. Who would even imagine, who would even imagine that a 5-year-old would even think about committing suicide? But our suicide rates in our Black boys and girls is escalating. Some of it's related to, being socially isolated during the COVID pandemic. And one would think that, when kids are not going to school, there would be less bullying. But that's not the case. There's something called, the cyberbullying that occurs online, Facebook, Twitter, Instagram, whatever. I mean, there's other social media platforms I'm not even aware of that these kids are using nowadays. I can't keep up with it.
Neither can I. In fact, I'm just now hearing about TikTok.
TikTok, yeah, that's a big one. Yeah, TikTok. and when a kid is bullied online, it's not like in school where it's one-on-one or whatever, or small number. It could be in front of 100 people or 1,000 people. How many ever people see that online post? And again, I mean, suicides. I mean, it's just mind-boggling.
Judy, I know this is your question time, but in terms of prevention, are there things that you can suggest to us parents, teachers, neighborhood, society, what have you?
We have, very much so. I mean, one thing is just to understand that this is a crisis. We're in a crisis state. To understand that, yes, it can happen to my child. A lot of times we think, well, that's going to happen to somebody else's child. I don't have to be concerned about that. So I think we should have, and I know I have 4 children. This is easier said than done to have check-ins with them, as a parent, a guardian, just to try to assess their well-being. A lot of times they act like they don't want to be bothered. They may shut themselves up in the room. Try to be aware if you see any change in their behaviors, attitudes. Maybe they're not participating in the routine activities, sporting events, music, whatever it is. I mean, that could be a sign of anxiety, stress, depression. And again, don't forget that a lot of this is accompanied by substance abuse. Not always, but it can be accompanied by substance abuse. And whether it's alcohol or other illicit drugs that a lot of these kids can get off the streets.
Self-medication.
Self-medication from your medicine cabinet in your bathroom. Their kids are inhaling different substances. Whether it's rubbing alcohol. I mean, it's incredible how what's going on. But yeah, actually, the main thing is just to be aware that this is an issue and try to keep your eyes and ears open and also try to know who your kids are associating with, who their friends are. Speak to their parents also, because I mean, your kid may be hanging out at a friend's house. And so those friends' parents need to be aware also to keep their eyes and ears open to see if they see anything as well.
So then what are some recommended approaches for the treatment of depression? Yeah. Now, we started out talking specifically about depression in men and Black men, but what are some of the recommended approaches for treatment of depression?
Yeah, well, the first thing is to realize is that asking for help, it's no longer taboo. It's not a sign of weakness. It's a sign of strength.
Good.
And, when I was coming up, that wasn't the case. But now, we recognize that everybody at some point in everybody's life, you go through stress and it's normal to go through stress. And, usually we can overcome and find solutions to what's going on, but that's not always the case. So don't be afraid to ask for help. I mean, that's the first step, and understand that help is available. I mean, there are mental health professionals at all the different medical centers in Cleveland, Northeast Ohio. There are private practice mental health practitioners. One organization that I recently became aware of is NAMI.
NAMI, the National Association for Mental Illness.
Exactly.
Yes. It's an old organization.
Yeah. And I had an opportunity to speak with Archie Green. He's one of their outreach coordinators. I forget his exact title, but he is very skilled in terms of counseling. He's got a social work background. So there are, a number of people that you can call. You can call United Way First Call for Help, 211. I mean, that's an excellent resource. I mean, they actually have a suicide prevention line 24 hours a day as well. So medications are an option. They're not necessarily the first thing that we, want to prescribe to individuals, antidepressants, but they have their role. But see, you can't just get pills from a friend off the street or whatever, because you could have side effects. It may not be the right thing for you. So you need to see a mental health professional. psychiatrists, psychologists, social worker, case managers, even your primary care providers, other physicians. I'm a urologist, but I try to be aware of the total patient. So, if you're having problems, you can go to any doctor and ask for help. Advanced practice providers, which can be physician assistants or nurse practitioners. So yeah, I mean, more than ever today, there's opportunities to access resources for counseling, advice, treatment. So yeah, I mean, but the first step is to realize that you're not alone.
Yes.
That's a
yeah.
big one. Yes.
Yeah, a lot of people think this is just happening to them, and that's not the case. And that's why it's so important that you're covering this topic. I guarantee you, there are going to be people out there, young and old, black, white, brown, who are experiencing problems and thought they were in isolation. But yeah, there's help out there. It's available, and you're not alone.
Judy, we're getting a little low on time.
So thank you, Dr. Modlin, for such excellent advice and observations. Sue, would you help us to wind down our podcast?
Well, yeah, I can do that, I hope. We want to thank Dr. Charles Modlin. I'm so happy to reconnect with you because it's been a minute since we've been able to see each other. But applaud you for all the work you do in the community. And we certainly hope we can have you back during this entire series on mental health issues and using the arts to help people address mental issues and not totally clinical. Now you use a holistic approach. You try to deal with the entire body and soul and mind of your patients. Now we will be putting up your contact information. Tell us quickly what is your email address that you prefer and or phone number, that if people want to follow up with you for further advice or resources, they can do.
So yeah, the best email is cmodlin@metrohealth.org. It's cmodlin, which is cmodlin@metrohealth.org. That's the best way to reach me. As far as the phone number, let me. I haven't got it memorized. I haven't been to Metro that long, so let me see.
You're as bad as I am.
Yeah. Let me see. So, I would say 216-778-8356. I mean, people can call me. That's the Metro Health Urology office also.
Good. And what Judy and I will be doing, we will be co-coordinating this series on mental health and using the arts to help people address issues that they are facing, primarily loss of something, and that results generally in depression and anxiety and other forms of what do they call it? Acting out and what have you, things that manifest. We were so happy to learn about children, young people that I knew it was, well, bad, but I did not know it was to the extent, or we didn't know it was to the extent that you had expressed. So we want to add that dimension to our healing arts discussions. One of the plays that we're doing does have young people in it. And so that will give some reflection, which you'll know more about. We'll be sending out information about the project, the performances from drama theater. 4 playwrights have submitted their plays dealing with mental health issues that the characters express. And we also will be having performing artists who through dance, music, poetry, instrumental and vocal music will demonstrate how that can help heal and soothe the soul. And then we will have, of course, folks like you, professionals in the mental health, even though you're not directly a mental health professional, you're a medical professional, you do cover it extensively in your practice. So we want to thank you. Judy, do you have any close? And we will have information up on this broadcast about how people can reach you. And before I turn it over to Judy, tell me the title of your book what did that deal with? Did that deal with mental health at all?
So the title of my book, I wrote a book that was published last August, and it's available up on Amazon and Barnes and Noble, other sources. The title is called "It Isn't Difficult to Do It If You Know How to Do It."
Okay.
It's a success navigation book. I was honored several years ago to give a commencement address over at John Hay High School, and during the commencement address, I left the students with a lot of information that I thought it was important that they needed to know at their young ages, that information that I wish I had known at that young age that would have helped me navigate my success journey. And I expanded my commencement address into a book form. The title, "It Isn't Difficult to Do It, If You Know How to Do It," came about. I had a 3.5-year-old daughter at the time. She's 24 now, Hannah, and she was playing a video game. We had a nanny at the time, and the nanny was watching her. She goes, "Hannah, that looks very difficult to do. Is it difficult to do it?" And without missing a beat, 3.5-year-old voice, she goes, "It isn't difficult to do it if you know how to do it."
Okay. All right.
know,
Well, now we'll get the title of your book as well.
Yes.
So Judy, if you would close us out from here, that would be wonderful. And again, be on the lookout for more information about the project, and look for Dr. Charles's interview up on YouTube in the very near future. Judy?
You got to get me in as an extra for one of your plays, get me in as an extra,
You got it.
Okay. All right. Thanks.
I don't mean to embarrass you, Dr. Modlin, but I will just conclude by saying you are a blessing and an asset to our Northeast Ohio community. And we just thank you from the bottom of our hearts for your being with us and all of the great work that you've done and will continue to do. We salute you. Thank you, and God bless you. So at this point, we will say goodbye, and we look forward to seeing you again during another podcast for the Healing Arts.
Thank you very much.
Take care.
All right.
Bye-bye.